Hi everyone, welcome back to our channel, The Nursing Insights. Let's start our 5-minute series 1 with IV fluids. So I'll be explaining the topic in 5 minutes. So it is easy breakdown for both students and the nurses to clear it out easily. So normally IV fluids are, we all know NS, RLD, NS, 5D, 10D, 25D, all these are under IV fluids only, and we will inject them whenever there is need and necessity. So coming back to different types of IV fluids and their indications and contraindications and common mistakes we'll make during the bedside practice. So first is crystalloids. So it is one of the classification of IV fluids. Crystalloids are having those fluids which will be contain small molecules, so they will move easily across your membranes and blood vessels. There are 3 types. First one is normal saline, the common most IV fluid we'll see in the bedside setup. Second one is ringer lactate, and third one is the dextrose solutions, nothing but 5D and 10D. So generally we use them during dehydration and blood loss if the person is in hypovolemic shock. So you should have the basic thing you should remember about these crystalloids are they are very most commonly used, and they are cheap, they are quick, and they are the first choice of IV fluid for every emergency existing, nothing but the dehydration and the blood loss, and they are safe to give in these indications. So normally ringer lactate is given in dehydration, and for blood loss we will give the normal saline, which consists of 9% sodium, which will pulls all the fluid into the body, retains the fluid into the body, so it is easy for blood loss patient to not lose the fluid outside the body. So these are called crystalloids. They contain the small molecules in their fluid, hence they can move easily across the membranes. Coming back to another type of IV fluid, that is colloid. So this is the classification based on molecules. So you can write a flowchart types of IV fluids based on molecules. First one is small molecules, that is crystalloids. Second one is large molecules, that is colloids. So the example, so these due to their large molecular structure, they stay in blood vessels for longer period of time. So the examples are albumin, dextran, and hetastarch. So these fluids will give, these concentrated fluids will be given in severe blood loss condition, burns, shock, and hypoproteinemia. So blood loss is all we know, that is which will tend to cause hypovolemic shock. Coming back to burns and shock or the other common conditions we'll see. Coming back to hypoproteinemia, where there is protein loss in the blood, it might be due to loss of protein in the urine also. Hypoproteinemia is condition is seen in mostly CKD patients, that is chronic kidney disease or nephrotic syndrome cases. So you have to, the bonus tip or memory trick for you people is colloids. These colloids can be used, and these are the fluids which stay in circulation for longer period. So that is the reason we'll give them in conditions like burns and shock, so where the fluid retention is an emergency. Coming back to based on the tonicity will classify the IV fluids. So nothing but the constant here is blood. If the fluid is same as blood, if the concentration of the fluid is same as blood, it is isotonic. So the example are normal saline and ringer lactate, nothing but RL, NS and RL, both NS and RL, the common IV fluids we'll see in the bedside setup. So we'll give in shock and dehydration conditions. So remember, the constant here is blood. If the fluid is as concentrated as blood, then it is called isotonic. So there will be no fluid shift because the blood and both the isotonic fluids will be same in the concentration. Coming back to hypotonic. So if the fluid is lesser concentrated than the blood, then it is called hypotonic fluid. So I have already said, if the blood is constant here, if the fluid is similar to blood, it is isotonic. If the fluid concentration is lower than the blood, it will be called as hypotonic. If it is more concentrated than the blood, it is called hypertonic. So the example are half NS, 0.545 NaCl, that is half NS, and 5D, that is 5% dextrose. Coming back to hypertonic fluid, where the fluid will be more concentrated than blood. So you can see the commonmost hypertonic fluid we'll see in the bedside setup, that is 3% NS, also called as vitrinal. So the 3% NaCl is sold in the brand called vitrinal. We'll see in the bedside setup. Coming back to 10D and 20D. So these are the types of fluid we'll see in emergency or casualty departments. So common uses. So if these fluids are used only in one condition, that is severe hyponatremia. So when the person is suffering from lower levels of sodium in the blood, so that condition is called severe hyponatremia. So to rapidly increase that sodium levels, we'll go for giving these fluids such as 3% NaCl, 10D and 20D. So coming back to this is revision table for you guys. You can ask me. I'll send you the image in the WhatsApp group if you want to subscribe our channel, the Nursing Insights.